A lot of us know we grind our teeth, but is it something we can ignore? Is it temporary? Can it happen at different stages in life? Do I need to get it treated? Lots of questions about teeth grinding or bruxism. And to answer that today, we have Dr. Pashmini from Serenity Dental. Welcome.
Thank you so much.
Certainly. So, grinding our teeth, give us some background. What do we need to know?
Let's just start with about 70% of the US adults grind their teeth. This is a statistic that I got from the ADA website. It's not something I
Wow.
make up or based on, and I see a lot more of it, honestly, in my practice, especially in the last few years since COVID. Stress is a major cause of teeth grinding. And when we say grinding in general in dentistry, we call it bruxism. And bruxism is grinding and clenching. So some patients are like, oh, I don't grind my teeth at all. And I'm like, yes, you do, because your teeth are all worn down. They're all flat. I see crack lines everywhere. You do grind your teeth.
Mm.
And they're like, well, my partner doesn't tell me I grind my teeth. They don't hear me, but they might just be clenching their teeth when they sleep. A lot of us, stress is a big cause of bruxism in general. We tend to take it all out on our teeth when we sleep. And some people have absolutely no symptoms of it. They don't have jaw pain. They don't think they're grinding. Nobody's telling them they're grinding. But then when we take a look in the mouth, we see all sorts of signs. The
Mm.
signs are your canines are getting flat. Because our canines are supposed to be nice and pointy. So if they're flat and your front teeth are kind of chipping, the back teeth might show some little wear marks on the cusp tips. We
Mm.
get gum recession. We get a lot of teeth sensitivity. One of the major things that we hear when patients call is like, hey, my right side of my face is really painful. I have a lot of toothache, but I don't know if it's the top teeth or the bottom teeth. Well, that's usually a telltale sign that you've been clenching the heck out of your teeth that night. So you're
Right.
stressed, you're going through a life event or something. Another big cause of that, of bruxism, is sleep apnea. We are getting more and more diagnosis of sleep apnea from our patients. They are either it's because we have better diagnostics or people are more aware of it. But now we know that sleep apnea and grinding bruxism go hand in hand. So if sleep apnea is a major factor in causing the bruxism, we obviously want to treat the sleep apnea part first. It could be whether wearing a CPAP machine at night. If my patient is wearing a CPAP, I almost always recommend the mouth guard to go with that because you're still grinding your teeth. We're treating the sleep
Mm.
apnea, but the grinding is still damaging the teeth. There are oral devices we can make that actually, depending on your severity of sleep apnea, can treat both. So it's definitely worth talking to your dentist about it and seeing how we can treat it. Grinding actually causes a lot of damage to your teeth. My own husband broke two teeth in the last year.
Mm.
He denies having any grinding, clenching. I don't do it. Yes, you do, sir.
No,
I
not
had
me,
to do
not
root
me.
canals and crowns on them, so I know that you broke them. And one of the easiest fixes we can do for grinding is just getting you a night guard. So night guard is a splint you wear at nighttime. It separates your teeth. It's not going to stop grinding, clenching. It's just going to prevent any damage to your teeth. So it's like a protection. It's a band-aid on the problem. A lot of times misalignment of the teeth. So if your teeth are all crooked and they're not coming together right, causes a lot of damage on the teeth. And you might not necessarily be grinding, clenching that much, but you are wearing your teeth down. And usually by putting the teeth in proper position, which includes orthodontic treatments, so Invisalign braces, all of that, then it can correct and help a lot with that bruxism as well.
Got it. So if you do get an oral appliance or a night guard from a dental professional like yourself, that's something you'd probably wear continuously for the rest of your life. As you said, it doesn't cure, it doesn't make it go away, so it's probably a permanent.
It's something you wear every night. We have patients who say, I don't grind at night, I only grind during the day. No. If you grind during the day, you also grind when you're sleeping. You're just not aware of it because you're sleeping. So it's usually it's muscle memory. So if you're clenching, grinding, these muscles are so tense. During the day, they're also tensing up. So by wearing a night guard at nighttime, you're relaxing this muscle. So throughout the day, we see that the daytime grinding also gets a lot less
Wow.
for patients.
Wow, very informative. So 7 out of 10 people watching this video are likely to be suffering, clenching and grinding. Very informative, and
Absolutely.
obviously it's definitely something that needs to be treated and not ignored. So Very informative. I hope everybody watching this learned a lot about teeth grinding and what they can do about it. So, Dr. Pashmini, I appreciate your time.
Of course. Thanks for having me.
All right. Have a good day.
You too.